Hi, everyone. We want to thank you all for joining us this week. I am here with Tash and Sally. Sally Barker is an amazing nurse who works every day with people that are living with lipedema. Sally, we want to thank you so much for joining us today and just want to open it up to you to tell us a bit about what you do and about this condition that affects so many people.
Well, thank you so much for having me today. It's a real pleasure to be here finally. So my job role is as a clinical nurse specialist and advanced practice lymphedema practitioner, and I have the great pleasure of working with an amazing plastic surgeon, Associate Professor Ramin Shayan in Melbourne. Now, how I came into that role is an interesting story, but I am a person who has struggled with obesity my entire life, and I also had bariatric metabolic surgery in 2019, I think. Can't remember now.
Yeah.
And after I lost 100 kilograms in weight, I realized that my legs weren't any smaller. So I
Mm.
was diagnosed with lipedema. And through my journey of having that treated, I met the amazing Prof. Ramin, and he offered me a job on his team. So I went away, scurried away, and got myself trained as a lymphedema practitioner and headed back. Oh, as a registered nurse, I had to do my whole course again, and then headed back to,
Crazy.
yeah, craziness. Headed back to his office where he was true to his word and employed me. So we now manage, I now manage all his patients with lymphedema, which is a fluid issue where the lymphatic system fails and people get fluid collection in either their legs or their arms, but mostly with his lipedema patients who generally are diagnosed very late in their lives. So the statistics that have just come out is that these women, it's only occurs in women and very, very few men, that they spend, it takes them 30 years to get diagnosed. 30 years.
30,
Wow.
30 years.
30 years to get a diagnosis. And the main,
That's heartbreaking.
it is, especially when you think that the main symptom of lipedema is pain.
Yeah.
These women are living with pain for 30 years before they're getting a diagnosis. So it the the statistics say that it's 1 in 10 women that have
Mm.
lipedema, which is a huge number, but and that's that we know about.
Yeah.
A lot, tens of thousands that are undiagnosed. And um, the incidence of lipedema in the obese population, female population, has to be enormous,
Mm.
enormous.
Wow.
So in a group like BSA, you would be looking at 50 to 60% of the obese women on that group having lipedema.
Oh my goodness.
Very
Wow.
few would be actually diagnosed. And
So
well,
we're talking about more than 30,000 people.
correct, correct. The and as I said, very few of those are actually ever diagnosed. There's a lot of blame, shame, misunderstanding about why they can't lose weight. I was one of those, to a point
Yeah.
where you just give up.
Because
Yeah.
the lipedema, it doesn't just go away with weight loss, does it?
No, absolutely not. You can reduce your obesity fat or your lifestyle fat, but you can't diet or exercise away lipedema fat. And that's because it's actually a loose connective tissue disorder. It's not actually a fat disorder. And that the fat part of it is the end of the process.
Right.
So what happens is that you get this loose connective tissue, you get leaky blood vessels, you get a poorly formed fascia, which is the layer above your muscles, and it sort of holds all your tissues together so they're not just all flopping around inside you. And they've even found that the extracellular matrix, so this the little tiny network of tissues that hold your tissues together, is really weak because women with lipedema have really poorly formed collagen and elastin. And so that seems to have lots of holes in it, and those holes fill up with fluid, and that fluid has waste product in it. And the waste product causes inflammation in the tissues. And then the tissues go, oh, I don't like that inflammation there. I'm going to harden that tissue up so it's not, it gets scarred and what we call fibrotic. So that becomes, you get these hard lumps. And then the body says, oh, I don't like that either. So it sends these fat cells, adipocytes down. And so you get fat forming as well. And this fat forms into these hard nodules. So you'll see on some women's legs that you can actually see these big hard nodules that look like grains of rice or peas under the skin. Often people say, oh, I don't have those, but they're covered by a layer of normal fat, so you can't see them. But when you lose weight, and this happens in the bariatric population, they suddenly lose weight, and then all of a sudden all they can see is these lumpy nodules. So the key to the issue is really the inflammation. And so when you gain weight, you create inflammation in your body, and that drives the lipedema to grow more. When you lose weight, the inflammation goes down and the growth of the lipedema settles down, but it doesn't go away. So it's a really, really complex intertwining of different body systems.
Yeah.
It's quite complex to manage. The key to managing it is reducing inflammation. So I generally talk to people about what can we do to reduce inflammation, and I talk about 5 things. One is we lose some obesity fat, but we base that obesity fat on waist to height and waist to hip ratios, not BMI, because a BMI in a person with lipedema is completely abnormal.
Yeah.
So I have a friend who is exactly the same weight as me and exactly the same height as me, and her waist to hip ratio is 0.90, which puts her in the high risk range of visceral fat and obesity-related disease, diabetes, heart disease, cancer. Whereas I weigh exactly the same height, having identical BMI, but mine's 0.69. So I'm in the below the low risk range, but I have lipedema. She does not.
Yeah.
So
Wow.
my fat is sitting in my legs and my bottom and my arms, not around my organs. And that's why it's really important to distinguish that. I was talking to a lady today. She weighs 117 kilos, but her waist to hip ratio is 0.79. So she's under the low risk range. But her
Wow.
BMI is 39.
Yeah. Wow.
So weight loss is important, but it's not as important as what that BMI would indicate. It's
Yeah.
more about reducing inflammation. So reducing weight is important. Eating an anti-inflammatory diet is really important. But I like to talk about what can we eat that's going to help our body fight inflammation rather than constantly thinking about restriction.
Yes. Oh, yes, please.
Stop cutting stuff out and concentrate what you are going to eat that's going to help you. And that gives you permission to eat.
Yeah.
Massive problem with women in general, but women with lipedema, it's out of control. We're constantly restricting our intake. And then number 3 is really not very popular, but that's wearing compression. And so that wearing compression, medical grade compression stockings, helps move that excess lymphatic fluid from the leaky vessels and from that fascia and tissue that's got lots of holes in it and collecting fluid, and that inflammatory process where there's excess fluid. It helps move that fluid back up to the heart so that it can be filtered and gone out, out through your kidneys. So it's not comfortable wearing compression, but it's the most important thing that you can do to help lipedema, because that inflammation causes so much pain and discomfort, and heaviness in your legs specifically, but arms also. And lipedema can occur in tummies and boobs and all over the place. It's not just restricted to legs. That helping that fluid move along reduces that inflammation, helps with the pain, helps with the heaviness. And then the fourth one is exercise. So exercise is important, but we don't want to do any high impact, because when you're doing high impact, you're putting pressure on your joints, then your joints get inflamed, and then you get lipedema growing over the joints. So that's kind of not helping at all. So, supported exercise, and the gold standard is jogging or walking in water, because water provides 90 millimeters of mercury pressure. So you're getting all that compression as well as the movement, and you're looking at when can you activate that muscle pump in your calf to help push that lymphatic fluid up. So your calf muscle is like a second heart. It pushes that fluid back up. And then the one that I love the most is the looking after your mental health, because spikes in cortisol, of course, will cause increase in inflammation. So that's a do it as I say, not as I do. I'm so good at that one. But, those are the general 5 things that I would say to people about managing it. But as we know that the bariatric community, there's such a lot of women that just don't understand why their legs aren't getting smaller.
It's it's at least once a week, but I get messaged personally, I would say every couple of days, with somebody that's distressed because they've lost weight and they thought that it was going to help, but they've still got heavy legs, or they've still got heavy legs and arms. And these are conversations that you and I have had, Sal, like for years. I remember, and Sally very kindly, like many years ago when I had my first round of plastics, actually came and changed my dressings for me. So Sally and I have met each other in person in real life, and we've talked about this topic for years, and the fact that there are so many people that are suffering because they just don't know that this condition exists.
And the problem is that GPs don't know what it is. Plastic surgeons don't know what it is. They're operating on people doing liposuction, and can I just say that when you can do liposuction to treat lipedema, but it's not normal cosmetic liposuction. It needs to be a very particular type of liposuction that targets those fibrotic nodules, not just sucks up the normal fat that's easy to suck up because it's more liquid on top. Because then you end up with these awful looking lumpy legs, because the hard fibrotic stuff, it's like concrete. You have to jackhammer it to get it out. It's still sitting there. So they get these really poor results. So there's a lot of plastic surgeons who don't know what it is. GPs don't know what it is. So people go saying they've got these painful, heavy legs. So the other, I don't think I mentioned that one of the other key criteria is easy bruising. So that's because those little weak walls on the blood vessels, they burst. And there's overlap with things like Ehlers-Danlos syndrome, which is another loose connective tissue disease. There's overlaps very commonly when you've got hypermobile joints and lipedema. You will often have ADHD or autism as well, which often goes undiagnosed as well. And then you have the issue of another condition which is quite common as well, which is mast cell activation syndrome. And the issue for us in a surgical setting, which is where I'm based, is that when you've got mast cell activation syndrome, if we test you for all the dressings and the drugs we're going to give you prior to surgery, you won't react to them. But as soon as we fiddle with your lipedema and stir things up, the mast cells get activated and suddenly you're allergic to everything. So you'll get rashes from your dressing, you'll react to the drugs, you'll get gut issues, brain fog, tingling in hands and feet. You'll get all sorts of symptoms that you hadn't had before because we've stirred up your mast cells and they've switched on. So the biggest problem with mast cell activation syndrome is that it switches on and off.
Wow.
I've just discovered that I cannot eat any leftover foods that are reheated because I can eat something fresh one day and then I heat it up to eat the next day and I have a massive reaction to it. So
Dame, you have that, don't you?
Yeah. Yep.
that's the
Once I
histamine
had
in the
my weight
food.
loss surgery.
Yeah. So
Um,
that's the histamine in the food. You're reacting to the histamine in the food when it's been in the fridge.
wow.
So
So it's not all just in my mind
it's not in
necessarily
your
then.
mind. It's not in your
Uh,
mind.
I mean, I've had people say to me, "Oh, I don't know what's wrong with you. You know,
Mm.
I can eat leftover food fine." And I used to love leftover food. Like
Yeah, me too.
I survived on that. That's how it helped me get to be so rotund and,
Yeah.
you know,
No meal prepping in my house anymore.
yeah.
Yeah, wow.
So I have to
Wow.
eat everything fresh because I react. As soon as I take a bite, I think, but I was fine with eating this yesterday, and then today I'm eating it and I'm going to throw up.
Yeah.
So it's quite, and it's quite instantaneous as well. So so if I go through a big mast cell flare up, then it's even some of my safe foods are not even safe anymore.
Mm.
So yeah, really interesting condition and very, very, very hard to diagnose because it doesn't show up on blood tests unless they're looking for the right thing and they happen to test you when you're in a flare. So there's a lot of research being done about this, about the comorbidities that go with lipedema, but it's very complex and there's not a lot of funding for it, obviously.
Yeah.
I mean, let's just face it, probably should say this is a fat woman's disease.
Yeah.
Yeah.
Yeah. Doesn't get a lot of attention.
Yeah.
And I think the sad thing is, one of the things that I'm sort of taking away from what you said earlier is that it gets progressively worse for someone because they're not diagnosed,
Correct.
and they sort of don't get the diagnosis until it's way out of control, and they finally talk to someone who has walked the path before, rather
Mhm.
than being able to go to a medical professional and say, what's going on, and they go, oh, this is a classic case of lipedema.
Mhm. And the thing is that the thing that interests me is that Lipedema Australia specifically changed the pronunciation of lipedema from lipedema because doctors were calling it lymphedema and the names were too similar. So they deliberately changed their pronunciation of the word to lipedema to make it different to lymphedema. But I still get referrals every day that say bilateral leg swelling. Okay, what
Mm.
does that mean? Or they'll say lymphedemia or lipedemia or lipodystrophy or lipo something or other. And there's all these words that are made up that don't mean anything.
Lipton's iced tea.
That's pretty much it sometimes. So, I have to be a bit of a detective and work out when the girls in the office get the referral, they run it past me and say, what's this one?
Mm.
I say, yep, bilateral leg swelling, that'll be lipedema. And so then I contact the patient and have a chat to them. And sure enough, they've got leg pain, they've got disproportionate body shape, they bruise easily, they've got
Yep.
lumpy textured legs. The other criteria is big fat pads at the inner knees, at the outside of the ankles, and you get your feet and hands are spared. So you get cuffing at the ankles and cuffing at the wrists. So the feet and hands are normal, which is unusual. So in lymphedema, which is a fluid thing, you would generally have one limb affected, sometimes both. And if it was in the lower limb or the lower arm, then you would also have hand or foot involvement. They wouldn't be spared.
Yeah.
So, but as it progresses over time, so you have different stages. I don't particularly like stages because a stage 1 person can have quite severe pain and impact on their quality of life. But a stage you know, as much as a stage 3 or a 4. But the stages are based on appearance generally. So
Right.
the stage 1, which are usually quite slim women who have slightly disproportionate lower legs, or thighs, and then you get a stage 2, which is a bit more advanced. Stage 3 tends to be quite big, fat pads, especially saddlebags, inner knees, front of knees, just below the front of the knees, knee overhang, elbow overhang, and they often get a B belly, so the belly goes out and then in, and then a big bulge underneath the belly button. And then and then stage 4 is really what we call lymphedema. So their lipedema has become so bad that it's impacted the function of the lymphatic system now, and that's now overflowing into the tissue. And so you've got lymphedema and lipedema, which is really hard to manage, really, really hard to manage.
Wow.
And that tends to get worse with weight increase. So the bigger you are, the more likely you are to go into a stage 4. But in saying that, I've got women who are stage 4, late stage 3, early stage 4, who have 80-centimeter waists, and that's normal.
My
That's normal
goodness.
waist size.
Mm.
So, but their bottom half of their body is enormous.
Yeah.
You know, big overhanging lobules. So this is something that is life altering and really needs to be managed better. There are probably, I would say, 5 known plastic surgeons in Australia that manage this. There are some who dabble in it, and there's a couple of phlebologists who do liposuction for lipedema as well. My boss, Ramin's, the only one who really does large volume liposuction and skin excision at the same time. Excuse me. So that's why he gets such nice results with his
Results.
patients. It's a
Mm.
different approach. And there's pros and cons for both approaches, but he likes to do it that way,
Yeah.
and takes out quite large volumes and gets amazing results, which, you know, I was very fortunate to have 8 liters of lipedema fat taken out of each of my legs after I'd lost 100 kilos weight. So that was what was still left in my legs.
My goodness.
So I
Yeah.
was at the time 80 kilos, I think, and I had 16 kilos of lipedema fat sitting in my legs. So very, very, very disproportionate and,
Mm.
you know, life altering. Well, life altering to have that removed.
Yeah. How are you finding it now, Sal? Like
I've
how
been
long has it been?
My first leg surgery was in 2020, right? I was
Yeah.
in hospital when first COVID lockdown hit, so I remember it. And I've had no regrowth in my legs at all. I've not needed any further surgery. So I've had one big surgery per leg. Um, and It's really been life-changing. For the first, I tell this story about, which is quite funny. You know, when we were in lockdown and we were all trying to avoid each other in the supermarket, and
Yeah.
you know, we had our masks on and we were trying to avoid everyone, keeping our 1.5 meters away from everybody. And I'd come home from the supermarket and my front of my shins would be black and blue.
Mm.
But I didn't realize how my shins were getting black and blue. And it was because my legs are so light now that when I go to move them forward, I kick them forward expecting them to be heavy. And I was whacking them into the back of the supermarket trolley. So I
Oh
was
my
coming home with
gosh.
these bruised shins
Yeah.
because I didn't realize how light my legs were now. And,
Wow.
you know, walking up and down a set of stairs without having to hold on, even though I'd lost all the weight, I still couldn't do that. I still
Yeah.
could not go up and down a set of stairs and trust my legs.
Yeah.
I didn't trust them. They were too heavy and I couldn't lift them up. I used to fall over all the time. I'd trip over curbs, land flat on my face. I had so many times where people had to pick me up at a normal weight because my legs were still so heavy. I'd go to pick them up and they wouldn't move.
Yeah.
So,
Well, I mean, 8 kilos is a lot of extra weight to
yeah,
be carrying.
Per leg.
That is just incredible, and
That's wild.
yeah.
gosh,
And imagine what it was before I had this lost weight.
yeah,
They were enormous. My legs were
Mm.
enormous, so disproportionate to the rest of my body. So, look, the the issue is that surgery is a great option, but A, there's very few surgeons who do it.
Mm.
We just don't have the interest in doing it.
Yep.
B, it's extraordinarily expensive because
Yep.
there's no Medicare item number for lipedema.
yep,
Therefore, private health insurance doesn't cover it. Sometimes, if there's lymphedema as well, or we can use weight loss codes, we can sometimes get it covered, get the hospital stay and the time in theatre covered by private insurance and Medicare item numbers, but you're still paying a huge fee for the surgeon out of pocket. That not all surgeons do it that way because if they're only doing liposuction and not skin excision, they can't use weight loss codes.
yep,
Mm.
Ramin can because he's doing the skin excision at the same time. So, that complicates things. But people keep
Yeah.
saying to me, oh, if only we could get it covered on Medicare. I make the comparison between bariatric surgery and lipedema surgery. So, bariatric surgery you can get through the public system. Do many people get it through the public system? Not really. And what's the
Mm.
wait time like?
yeah,
So it would be even worse for lipedema because there's so few surgeons who do it.
yeah,
So it's
and when they can't even really diagnose it yet.
that's right. Who's diagnosing it in the first place? So who can diagnose it, right? Do you wait 8 so our current wait times, depending on the patient, can be up to 12 months just to wait for a first consult, sometimes longer
Wow,
because of the demand. Um,
So what do people do?
yeah,
What
so there's the interesting things. My advice is either find a GP who specialises in it, which there are a few around now. There's a GP in Collins Street, Melbourne, that now runs a lipedema clinic. And there's another one in Queensland that runs a lipedema clinic. So
we
um,
love that.
it's coming, it's coming. And we're finding that more GPs are turning up to the Lipedema Australia conference. So
Awesome.
really helpful. But if you can't find a GP to diagnose you, you go to an accredited lymphedema practitioner.
yep,
And
Okay.
all lymphedema practitioners, so they are either remedial massage therapists who've done the right training, and they're accredited through the Australian Lymphology Association. That's who I'm accredited with. So they'll either be a remedial massage therapist, a podiatrist, a physiotherapist, an occupational therapist. They can be a osteopath or a myotherapist or a nurse.
Okay.
So, but they have to be registered with the Australian Lymphology Association, accredited with them, because that way you know that they've been taught about lipedema and lymphedema and that they can then prescribe and treat in the appropriate way. So
Excellent.
you can't just go, if you go to someone so one of the treatments that can be quite helpful in reducing pain and heaviness and inflammation is manual lymphatic drainage massage. Now, lots and lots of people do lymphatic drainage massage, but it's more relaxation or cosmetic rather than therapeutic. So
yep,
you've got to go to someone who's trained in the appropriate lymphedema drainage massage techniques that help both lymphedema and lipedema.
Okay.
And they're all listed on a Find a Practitioner website for the Australasian Lymphology Association. You can just do a search of your postcode and it'll come up with the accredited practitioners.
We'll make sure that we drop all of the links
Mm.
in the podcast as well,
And
so
the
that people
other
can
group
access that.
where there's lots of information is Lipoedema Australia, who
Yeah.
are well known throughout the world for their resources. So they have brochures for GPs. They have checklists for GPs on their website. So the
Wow.
GP can look at the checklist and say, does my patient meet these criteria? And they have information for patients and practitioners that specialise on a list on that website as well. So that's a great resource.
Yeah, that's excellent. I mean, it would be wonderful to think that in the future we will just see more and more doctors becoming passionate about this particular issue, so that people aren't waiting 30 years, 30 years to be diagnosed. And I would love to see it become sort of a standard thing that it's at least looked at when people decide that they would like to go down a metabolic bariatric pathway.
I think there's still some people out there that believe it's not a real disease and it's just an excuse for being fat. But if you look at the tissue, it's completely different. The fat is different. And that's why I think, Ramin is so keen on doing his fat mapping that their lab is doing at the moment to work out, what the differences are and what's what. But I think in order to get the word out to doctors, there needs to be research to validate it.
Yeah.
And then once you've got research, then it'll start getting taught in medical school. It's currently not mentioned in medical school.
Yeah.
And then once you've got it being taught in medical school, then you'll start getting people interested in practicing in that particular area. It's coming, it's just taking a long time.
Yeah. Which is sad
Like
for people that are waiting.
Yeah. I mean, I was put on a diet by my mother at 8 years old. So there was something happening at 8 years old that she thought was different. Now I've got 2 slim sisters. And
I was 8 as well.
Yeah. And haven't been off a diet since, really. So even eating, for me, probably my average would have been 1,000 to 1,200 calories a day. I got to 180 kilos.
Yeah.
Eating nothing.
Yep.
Purely because of that inflammatory process.
Yeah. I think back to my late teens with our mum, and she was always on a diet or starting a diet. And, just from the images, I guess, of what I've seen of lipedema, I can see a lot of them probably was something that mum was suffering with, but it was always just,
And Nan.
eat less, move more,
Move more.
and you'll be right. And it didn't matter what mum and Nan did. It never moved.
And I mean, even just touching them, they'd bruise.
Yeah. And the pain.
And the pain in their arms and legs. I have very vivid memories of Nan like picking her arms up like that. And I know now what it was, which I think is probably why I've always, while I actually don't feel those symptoms, I've seen it and seen the impact that it had on my loved ones. And it's why I've always been passionate about you getting to share this story, because I know that it affects so many people.
Yeah.
And the thing is, I probably haven't talked much about whether bariatric surgery helps. So some people say no, it doesn't help, but I've seen it hundreds of times. It does help. And why does it help? Because it reduces the inflammation. So
Yep.
the weight loss, especially a bypass, because of that change in metabolism, it does reduce inflammation. I think that's why we see better results in lipedema women when they have a bypass over a sleeve or a band or something like that. But in saying that, also Mounjaro, Ozempic, Wegovy, Mounjaro, especially Mounjaro, highly anti-inflammatory and very helpful for lipedema symptoms, even if there's no weight loss.
Wow.
Yeah.
So at the World Congress on lipedema, which is the second one they've ever had, it was in Rome in August. They had an entire afternoon of a 3-day worldwide conference just on Mounjaro
That's
Wow.
awesome.
because it's so effective
Yep.
in managing inflammation and decreasing lipedema symptoms. So it'll be really interesting to see the research coming out about that because there's a lot of people studying that at the moment. So it'll be very, very interesting to see what comes out of that.
It's going to be an interesting space, isn't it, for the next
Changing.
few years?
Yeah, 100%. So it's a watch this space kind of thing.
That's awesome. Thank you so much for sharing with us today, Sally. I know that it's taken us a while to get here, but we're very, very grateful that you are willing to give your very precious time to chat with us about this issue.
You are so welcome. My pleasure.
Yeah, no, we really appreciate it.